Good evening. Welcome. It's wonderful to be on Gino's spot.
Relax, sit down. Coming out of PE town. One drink, find a shot. Never mind your liver, get to Gino's spot.
Gino's spot!
Get to Gino's spot.
Gino's spot!
Have a laugh, have a giggle, and exercise your middle. Have a Gino shot.
Gino's shot!
Get to Gino's spot.
Gino's spot!
Get to Gino's spot.
Gino's spot!
Have a laugh, have a giggle, and exercise your middle. Get to Gino's spot.
Gino's spot!
Good evening, ladies and gentlemen, and welcome to our doctors, let's call it a seminar tonight about COVID. We've got all sorts of doctors popping on, and I am, of course, a doctor as well. I'm a doctor of psychology. I'm going to be a psychologist tonight, indeed. People always ask me, why psychology? Reginald, they say to me, why psychology? And I always say to them, my closest and my oldest friends, the people that I grew up with, and my closest friends throughout the years have always said to me, Reginald, you really should be in therapy. And so I studied it, and I did become that, And I was always marked. My life was marked with all sorts of psychological problems. Commitment, firstly. Commitment, even when I played tennis with my dear wife. I'd always, just so scared of commitment was I, that when I was playing tennis, it would always be, 15, I couldn't say love. I had to say 15, I really like you, but I'd like to see other people. I couldn't, And my wife and I have been very worried about the COVID lockdown, as I'm sure all of you are. Cyril has been on the television to tell us that we all may not enjoy ourselves at all for New Year's or for Christmas or for any holiday within 14 days. So unfortunately, we're all in a bit of the dwang. But what can you do? My wife's dream. I always found it so lovely. My wife's dream. She said that her dream, her bucket list, was always to fly to China and then walk along the Great Wall of China, walk through Mongolia, up into the Russian tundra, which is so interesting because it's something that I'd never want to do. So we'll tend to never do any of that. No, we don't want that sort of thing. My son, of course, youngster, teenage sons, oh, they are popping out everywhere during COVID, making such a risk, Of course, my son, I am very, very attached to my son. He means the world to me, particularly now that my liver is starting to play up. I need to, check that he's okay. Indeed. My daughter, and she travels a lot with her job. My daughter travels very much throughout the world. In fact, she's a drug mule. What can one do? One's parenting does stick out like a sore thumb sometimes. And when I was a young child, of course, I was, of course, a specialist in laughter, really. Laughter. I'm a specialist in laughter because when I was young, I used to laugh a lot when I was a little baby. And I always found that laughter is the best medicine. I always prescribe it to my patients, except if you've got diarrhea. It's not so good if you've got diarrhea. Laughter, don't worry about that so much. Indeed, ladies and gentlemen, welcome to Gino's Spot. We're talking about COVID tonight. I'm going to sing a little song for you right now, and I've got a little guitar that I can put in here as well. Fantastic. Put up some comments, ladies and gentlemen. Put up the comments. Stick them up in there. That's right. Good evening, Pat Wood. Lovely to see you. Yeah! Get your motor running. Head out on a highway. Looking for adventure. And whatever come our way. Yeah, now I'm gonna make it happen. Take the world in a loving embrace. Fire all of your guns at once and explode into space. I like flame and lightning, heavy metal thunder, rushing with the wind. Looking forward to a very easy evening. Yeah, darling, I'm pattern creamy. Take a world in a loving embrace. Michelle tells birds here as well. Going into space, like a true trace is time. Brandon Lorenzo, just what I need. A great big Vivian Trobeck is here. Sing it. Carol Jean Flores, yeah. I'm a Cathy Marsh. Mary's in Aurora. Jennifer's sitting at home. That wood is born to be wild. And whatever come our way. Yeah, it's all gonna make it happen. Take a world in a loving embrace. Darling, these poeters here as well. But hey, on, like a true nature's child. We were born, wanna be wild. Taryn Lane is there. I hope you're doing lecture too. Born to be wild. Mike Forward, yeah, that's me, baby. Hi, welcome to Gino's Spot, ladies and gentlemen. Hello, Shirley Sitzman. Lovely to have you aboard tonight. Woo, let's take these glasses off. I can't see out them. All right, we have an interesting show tonight, and it's not all fun and games. Gabby Hewer, nice starter indeed. It's lovely, isn't it? I like it. It's a guitar. It's my little Telecaster. Let me introduce you to my little Telecaster. It's a little American Tele in 2006. It's a little anniversary model, and it's beautiful. How's that sound? Sounds nice. All right. So we've got a busy show tonight, all on COVID. Indeed, we've got a whole bunch of experts, our experts here in Port Elizabeth and surrounds, and we are going to be asking them all the questions that hopefully you would want to ask. Oh, good. Hello, Nico. Oh, Nico. Goeiemiddag. I'm wearing my safari pak because that's what the doctors used to wear in the 1970s and early 80s. I think if it went that far back, certainly the 60s. This is my Chris Barnard outfit, which I thought was a good plan. All right. Gino, big shout out to the docs, nurses, and the frontline heroes. You are right. You are right. We're paying tribute to that tonight as well. These guys are on the front line, and they're getting fatigued. They're getting tired, and we need to keep them. We need to keep them up, keep it up, because the second wave is hitting hard, and we need to make sure that they are feeling good and full of energy, because that's what they need to look after us bastards, right? Indeed. Anne Wallace, lovely. Trying to watch, and you can't find it on YouTube. I think there is a YouTube. Look for Center Stage Live. It should be there. Center Stage Live COVID. It should come up. It should come up there indeed. Maybe Gary can actually post it in the comments as well. on there. So you can post it. We've got about 8 destinations that we're sending to, so that all of you can get the information that you need. There we go. Center Stage Live. We got it on there. Obviously we're gonna be calling them on just now, but we're always with Gino Spot. We've got to first thank the sponsors, Fitch and Leeds. I hope you've all got a drink, because my God, you need a drink this week. Hell's bells! Everything was going so nicely. Chris van Vuren, hello. Nice sound on video. I'm glad to hear that. At least there's a sound guy out there that can okay the sound. Excellent. Thank you to Fitch and Leeds. I'm using the little blue tonic tonight, a little bit of gin and a little bit of tonic. And of course, Spa has been very kind to us and been sponsoring the show, keeping us going during lockdown and keeping the spirits up. That's what we need. And of course, Amobia, our internet provider. Thank you so much to Nicola and Toinette. Always very, very helpful with the internet, because you know what the internet is like. You just don't know what's going to happen on the YouTube. All right, so I hope everybody's on board and online and ready to go. We're going to, first of all, we always do with Gino Spot, we do What You're Watching with Darren Fuller, and we have Darren coming in live from somewhere here in Port Elizabeth. Derry, please, let's have a look at What You're Watching. Hello, Darren.
Hello. Greetings.
Greetings. Cheers to you.
Hello.
Oh, there's your Yoda. You've got a Yoda with you.
Cheers to you. This is also
Cling,
Fitch and Leeds. It's cheeky
Excellent.
cranberry, FYI. Yes.
Oh, nice.
Mhm.
Like that cheeky cran. It's got a bit of I think it's got a bit of a spice to it. A little bit of
It has a bit of a bite. It's true. Yes. To make up for the bitterness of no alcohol for the rest of the year.
Yeah, bitter, man, bitter. Mark Banks. Hello, Mark Banks. All the way from Darling, or wherever you go to hanging out now, Mark. Lovely
Hello,
to
Mark.
have you on as well. Mark's, of course, been a regular on Gino Spot for quite a few shows.
Come on.
But Darren, Vivian said she bought her Fitch and Leeds at Spa because she never wins the competition. Maybe tonight's your night, Vivian Trobeck. Maybe tonight.
I'm wishing for you. I also bought mine at Spot, just by the way.
Yeah, oh, good.
Yes.
Darren, take it away. Let's listen what we should be watching.
I shall. Okay, so hello, everyone. Yes, this is baby Grogu. It's my newly adopted son. So just in case you haven't watched The Mandalorian yet, do it. You have to watch The Mandalorian. The last episode of the second season, it's mind-blowing. Anyway, so what I have been watching, my sister is down from Scotland, so I have been somewhat and not so much watching, but I've managed to watch some older things, which I thought to mention in any case, because, you know, since we have to stay at home for the next couple of weeks anyway, what do we have to do but watch Netflix? So, okay, like I've been saying for the last couple of weeks, Bridgerton started on the 25th of December. Like I said, I've been a fan of the books for years now, so I was really, really excited for it to come out as the series. It's produced by Shonda Rhimes, who's created Grey's Anatomy, etc. These are some of the books. Julia Quinn. I haven't finished it yet, but it's amazing. It's so good. It's like Jane Austen, but far, far, far racier. But it's very good. It's very good. There are some differences from the books for anyone who may have read the books. If you haven't read the books, I don't think you have any reason to actually dislike it. It's fantastic. I'm really, really happy with it. Other than that, okay, so I don't know if you guys love Disney as much as me, but so Mulan, you know, Mulan came out with their live action remake. I don't know if you can do any better than Disney's Mulan. I mean, she saved China. It's the best princess. But I watched the live action. I was very not looking forward to it because, you know, there was no music. They changed the characters. I wasn't really looking forward to it, I must admit. But going into it with such a negative headspace, I actually really, really enjoyed it. It was actually really good. You know, expecting no music and different characterizations, it was still really, really enjoyable to watch. It was, to a certain extent, I suppose, quite realistic. In any case, if you love Mulan, please watch the live action. It was actually really enjoyable. Okay, this is also, I'm very behind on the times here because like half of my Facebook was chastising me for only starting this now. But I started Schitt's Creek, not swearing. Started it maybe a week ago. I'm already almost finished the second season. It is hilarious. It's so good. I mean, with Dan Levi and Eugene Levi being the creators and the actual father and son, you couldn't expect anything better, but it's so fantastic. I really, really enjoy it. It's so funny, and they're like 6 or 7 seasons, so it's the perfect binge series for now, and they're only like 20 minutes an episode, so that's really great. Other than that, movies to watch, Death to 2020 is a mockumentary that's just come on to Netflix. It's got a lot of famous actors in it. Hugh Grant, a lot of famous actors. It looks very funny. I haven't seen it yet, but I'm planning on watching it. And then, you know, other than that, I just have to do this. For everyone who likes Rick and Morty, you know, I always get things. And other than that, you know, to be honest, I've just really been reading lately. So just for example, A Stranger in the House. I don't know if you watched it. I mean, well, read it. It's very good. And The Rats by James Herbert. And A Forward by Neil Gaiman. So you can blame Nadine Lart. I think she's also been on the show before, for The Littlest Bookshop in Maltino. She basically takes all my money like she's a drug dealer every couple of months because she has so many cool books. That's about it for me for the week.
Oh, that was funny. That was very good. Very good, Jenny. Mulan can't get better because she saved China.
She saved China. I mean, like, you can't beat that as a princess.
A billion people, you know what I mean?
She saved the whole of China. Like, she saved them all. Yeah. So, yeah. I mean, you can't beat Mulan.
Absolutely. And I've been loving Schitt's Creek as well. I've been watching it. It's great. I think that Stevie, the receptionist, she's the best character.
Oh, she's so funny. Everybody's so good in that. And did you know that Twyla is actually Eugene Levi's daughter as well?
Oh,
a real daughter. His real daughter.
Sister.
Yeah. Yes. Yeah, they actually are. So it's like a whole family thing going on there. It's really funny. I enjoyed it.
You know, it's funny, the actual name stopped me from watching it in the beginning because I thought, no, it's a stupid joke, you know. But actually, if you realize...
I know. I watched the first episode and I was so unimpressed, and that was years ago. Yeah. And then I restarted it, and like I said, I've watched 2 seasons.
Yeah.
Like,
we're in now. We're in now. We're totally addicted now.
Schitt's Creek is my jam now.
Excellent. What's this guy's name again? Grogu?
This is Baby Grogu. So, yes, it is the same species as Yoda, but it is not a relation.
He's got sunken eyes, that's for sure. He's been drinking.
Oh, he's adorable. So adorable. So yes, watch The Mandalorian.
Will do. Thanks, Terry. Fantastic, as always. Bye. Bye. Oh, my word. Always something different. Always something happening there with Terry. All right, ladies and gentlemen, it's time to dive in. It is already, we're already running over. So we are going to call in our first guest, who is Rob Campbell from the Nurture Group, CEO of the Nurture Group. I believe that is your title, Rob.
Or something. They let me think I'm in
charge. Your main title, of course, is husband of Jennifer Lindridge.
Yeah, indeed. I know my place. I think it's called Dr. Robert Lindridge.
Oh, you gotta love that. Dr. Rob, it's lovely to have you on board. We've got quite a few doctors coming, but I wanted you to actually stay with us throughout. You know, just to add in your £2.10s worth. Tell us a little bit about your background. Hello, Anne. There's Anne. Is that your mother-in-law?
That is my mother-in-law, the one and only.
She's watching. She's watching you.
I can say what I want now.
The shirt, well done. You're quite right. The mask goes over your nose. It's true. Yeah. It's always that, eh? There's always that. Oh, Rob, so just give us a little bit of a background about your history. You were a GP at one stage.
Yeah. Gino, I'm a PE boy. I studied medicine and practiced in family medicine for a while. And then we found the building at Aurora, and we started Aurora Hospital in 1999, and we've grown into an organization called Nurture Care Group, and we have hospitals with 500 beds, 600 employees, dotted around Cape Town, PE, Durban, Free State, Gauteng, and we provide mental health services and physical rehabilitation services in a niche group of hospitals across the country. So we have our fingers in all sorts of pots.
Yes, absolutely. And there are a couple of groups within the company. I see there's a mental health section, there's a rehabilitation section, and any standard hospitals as well, or is it just?
No, we've got a couple of acute hospitals in Namibia and Swaziland who are related to us. In South Africa, we are mental health hospitals under the Mondia brand, and physical rehab hospitals under the Nurture brand.
Okay. And COVID, I mean, obviously COVID's had this onslaught. How has it affected you guys?
Gino, it's been devastating in that it's really rocked the safety of our patients and our staff members. It has at times reduced the numbers of patients in our hospitals. It's been difficult to get through. It's ironic that in the middle of a pandemic, we see numbers going down, but people have been often frightened to come to see their doctors and to seek medical care, frightened to be in hospital. But as the COVID surges have happened, we've seen large numbers of people coming to us recovering from COVID, who've been really badly hit by the illness, and also a lot of people who've been really traumatized emotionally by the scope of the lockdown, isolation, the illness itself. So it's been, we very much come in at the back end in a very niche setting, and my colleagues who are working in the acute hospitals have really had the brunt of the serious pathology. But we've been kind of mopping up the edges and looking after the people who are recovering from very severe COVID.
So you guys would feel the brunt of the surge only maybe a couple of weeks or after the main thing.
Very much so. I mean, it takes a good two weeks for people to get really ill, then another 2 to 6 weeks for them to start to recover if they've been really ill, and then we may see them coming onto us, the sickest of the sick, who've really been in hospital and ICU for an incredible period of time and pulled through by the skin of their teeth.
Yeah, this is the thing. I mean, I think you guys are getting pretty much getting the guys that have just pulled through, you know.
Yeah. And it's awesome to see the amazing work that's being done in our public sector and our private sector, the way that guys are really pitching in and giving of themselves to pull people through wherever we can, and to see people surviving through that who often haven't seen their families for 6 weeks.
Is that one? That one must be one of the biggest, biggest deterrents for people actually wanting to come into hospital, and people almost putting it off, in terms of like the fact that they're not going to see anybody once they go into hospital. They're isolated completely, and that must be a very scary thought.
So the isolation has been a very, very real issue that I think none of us could ever have understood a year ago. And certainly there are mechanisms that we can use to overcome it. As I said earlier today, Gino, you're not the only person who's gone online. We've had patient-family meetings, family interactions, virtual visits happening online. And that's become a big feature of our lives, and where nurses and doctors and therapists out of their own bat have taken their phones into places where people are critically ill so that they can connect with their families.
Yes.
And bring a very, we get caught up in the pathology and the sickness of this all, and we forget about the real people who are really feeling frightened and alone and cut off from their families in the middle of this. And I think it's a big issue that we need to attend to, the human being in the middle of the illness.
Yeah. Absolutely. I see. You see, you're getting some love for your shirt here. I see Jolene is saying great shirt, as well as you. She's got the same taste as your mother-in-law.
Yeah.
We're so blessed to have Rob as a must-love family member. The man is truly a treasure, and that's coming from your own family, Rob. That is a good. That's an indictment on you. Very.
I paid them a lot, and I bought them lots of Christmas presents to say that.
Oh, love this. There's some more love for your shirt. Oh, good. I mean, you know, and everybody knows the rules. This is the thing. Everybody knows the rules, but when you're out there and when you're in that zone where you just everybody's just dying to get out there and hug people and get you know, it goes completely against human nature to actually to do this stuff. You know.
Gino, I mean, I think that there are people who know the rules and are flaunting them, and you know, it's difficult to understand that. But there are also people who are just genuinely tired. I mean, we've been living this for almost a year now. People are getting tired. That kind of COVID exhaustion is creeping in, and then there's also that element of us needing to be incredibly disciplined. You know, if we go into a theater where surgeons and scrub nurses are working around a patient, where there's that kind of 8 hours of intense, I'm not touching anything, I'm not going near anyone. Whereas that's now moved out into our worlds where I think Utant, one of the early Secretary Generals of the United Nations, said he who would keep his garden clean must leave no patch for weeds. There's a sense in which we just can't leave anything to chance. And that doesn't come naturally to most of us who haven't been involved in infection prevention. You know, the fact that I must always keep 2 meters away from people, that I must always have my mask on. People will go out with the good intention of going to a braai or having a bit of a meal with someone. Then suddenly the cell phone pops out and the selfies are had and the masks are lying on the floor. And everyone's cheek to cheek, and you know, a week later, someone's in hospital with COVID. And it's sad. It's unfair. It feels wrong. But it just is the case. And we're going to need to keep this up for a while still.
Absolutely. I mean, as a musician, I was been talking to people about it as well, is that as a musician, my entire job, my entire being has been built around bringing people together. The closer, the better. You know, if they can all be kissing at the same time, that'll be the best gig in the world. You know, but and yet, you know, these days we try, and there's always that hope that you'll get something. Like there'll be a gig. We can do a picnic gig. How about that? And then everybody can be on their picnic blankets, and they'll be 2 meters apart, and that's all very well, but you get there and you start doing a show and you're playing the music, and that music just gets everybody up and going, and then it ends up in a big party anyway. So it's just this for me as a muso, it's just an absolute nightmare. You know,
it's heartbreaking. It's heartbreaking, and it's real.
It is totally, and to try and still be keep people happy, keep their spirits up. Like it's okay, we can. Like Gino's spot was born on that premise, I suppose. You know, to try and cheer people up. At least it's online. There's no, you know, I can cough on you, and it's fine. But you know, holy moly, it just goes against everything in my being to have this sort of thing. But you know, we've got to do it. We've got to do it. And I've got we've got a couple of doctors coming on, and I'm gonna keep you online here, Rob. But just before we call on our first doctor, just your job at basically you're CEO there of all these hospitals, but your thing has been sort of controlling the infections, keeping it out, and then when it is there, trying to keep it in. I don't know. How you've been doing that? How's it been going?
So Gino, it's just really been about looking at what the recommendations that have come out of WHO, NICD, understanding what they mean in practical terms, and making sure that our people, our patients, our families, our staff members are meticulous about adhering to the rules and the measures all the time. That people are wearing their masks, their PPEs, washing their hands. all day, every day, keeping everyone safe. Also knowing how we will get on treating this illness when we do encounter it. How we'll cope with all of the problems that come along. And, you know, these bizarre issues. Do you know, like,
Yeah.
we started to, our COVID ward turns out to be the safest place in the hospital because we know it's there.
Yeah.
But it'll be the tea room. It'll be
Okay.
the entrance hall. It'll be the place where guys are sharing a smoke together. And
Yo.
the lighters being handed around from person to person, you know, with COVID
Yes.
flying from mouth to mouth.
What, the saliva on the Zoll or whatever the story is? What is that?
And those always in our establishment. But, it's those moments where we don't think it's going to be there, where we let our guards down to relax and breathe a big sigh of relief. That we get trapped. And I guess my role has just been constantly staying there to remind people that we cannot relax for a moment in our environment. Not at home, not on our way to work, and not while we're at work, so that we can keep our patients and their families, our people, and our families safe.
Yeah, for sure. Okay, Rob. Well, what we're going to do now is I'm going to call on Dr. Nicolas Thackwray is in the wings at the moment. I'm going to bring him online and just to say hello. And hello, Nicolas.
Hey, Gino, how are you?
All right, man. You can hear us and see us. That's all good.
Coming through loud and clear.
Excellent. I see you've got the COVID beard.
Yeah, no, this is me as a GP trying to look older, actually.
I think you're just trying to put Rob to shame here with all your hair all over the place.
No, not at all. Rob's got the grey crown of glory there that I do not have.
I no longer get the you must be too young to be a doctor.
Yeah. I get that every day.
Cool, enjoy it.
Enjoy while you can, Nicolas.
Hence the beard. Hence the beard.
Excellent. It makes you look a bit older. That's
but actually, interestingly enough, I shaved the beard off at the beginning of COVID because the N95 masks, actually, if you read the instructions, they say this does not work with facial hair. So you have to actually shave it off. Yeah. But thankfully, I'm not I'm not in intubating or creating any aerosol particles too often. So I do my surgical face mask, and that's I'm comfortable with that.
That's all right, man. But Nicolas, I mean, you're pretty much on the front line there with as a GP. Your practice, whereabouts is your practice? Just tell for the people out there.
I'm practicing in Fairview, Lorraine area in Port Elizabeth in Circular Drive.
Okay, and just I mean, just a bit about yourself. I mean, you've been practicing for. You didn't come from PE originally. You came down from Cape Town. Is that correct?
Yeah, born in Cape Town. Been in PE for 8 years. Started in St. George's emergency room in 2013. Okay. Then I did some time in Livingston Hospital in the kidney unit there, and then did a year in infectious diseases unit, and did my diploma in HIV. And then I started my own private practice 2016 in August. So been in Lorraine now going on 5 years now. So pretty new GP. So people are not inaccurate when they say you're young. I am.
Yes.
For a GP.
Indeed. But you've certainly been thrown into the pot with this. I mean, all medical practitioners have had a bit of a time of it. I mean, has this COVID has it affected your practice a lot?
Absolutely, it's really changed things drastically. so some sort of key areas have been just the patients that we're seeing just in terms of conditions. So there's been quite a reduction in the threshold of seeking help from a GP. So, for example, where before you wouldn't wait until things are at their most severe to go get it checked out. You would go sooner than later. But now people are holding back. The whole health-seeking behavior has changed completely. And so, whereas before, I mean, our bread and butter was coughs and colds, and I've also got a diploma in child health. So I used to see a lot of children, just a lot of coughs and colds, babies, toddlers, small children, and seeing very few of those type of patients now. So the whole patient profile has changed, but also obviously having to deal with COVID. We've done a lot of telehealth. So we screen all our patients, and then any flu-like illness, if a flu-like illness is the main complaint, we do that as a telephone consultation, and then if needed, then we'll bring the patients into the practice for assessment.
Rob was just talking about that in a conversation we had before the show. The fact that this whole online thing has taken off so much, particularly in the medical industry. So you consult online as well. Have you got a section that deals with that too?
Yeah, so telehealth includes just telephone consultation, so a voice connection, and then we do use WhatsApp quite a lot to send through images and those kind of things, and then some every now and then. We don't do it that often, but we'll do a Zoom consultation. But voice is actually, I mean, it serves quite well to. We were taught in medical school that 90% of diagnoses are made on history alone. So the examination,
really?
So the examination is there to confirm what you suspect from what the patient's telling you, and then you do some tests to clinch the diagnosis. So you can get a lot of history on the telephone.
Do you think that the internet has changed things in the way you're saying that a lot of guys don't come in anymore? But do you think they're self-diagnosing? Are they just Googling? Are the people scared to come in?
Absolutely, I think there's a lot of research that goes on when if a patient's got a complaint, they will definitely turn to Dr. Google, and so that's the one side of things. The other side is the more elderly patients who they're not comfortable with the telephone consultation, and so they're suffering a bit, I think, just being the most at risk population as well. And so but it's starting to become normal. I think people are starting to see a telephone consultation as a real consultation, whereas before it wasn't really considered.
That acceptance, eh?
Yeah.
Rob, what do you think of Dr. Google?
Don't confuse your Dr. Google with my medical degree. Look, I think that empowered, knowledgeable people can do a lot to manage their own health, but there comes that point at which you really need insightful, experienced expertise. And someone like Nicolas and the other GPs and family doctors in our community are doing an incredible job to screen for serious illness. And very often when people are scared to go into hospitals, they're also scared to come to the GP and the family doctor. But some are slightly less scared. And we're going to need to move, I believe, to a point in the next 12 months where people feel comfortable to come in. They believe that our practices are safe to come to, where the measures that are being taken there are acceptable to everyone, because we are seeing some people presenting later with malignancies, with serious cardiovascular problems, and other issues that should have been that should and would have been picked up earlier in the past. So we may have been over presenting to our doctors in the past, but we're now under presenting. We may have been worried well, but now we're missing.
That's a good point,
and I think it's really important for people to take that opportunity to make contact with their doctor by phone and say, this is what's happening. You don't actually have to go to the doctor now to get that initial permission to come in. Is this serious? No, don't worry about it. This is serious. You need to come in. And I would really encourage people to make use of that phone and other telehealth contacts with their GPs and family doctors to make sure, rather than just relying on Dr. Google.
Yes, absolutely, and you're quite right in that the Dr. Google doesn't pick, like you say, those long-term things that you just leave it and leave it and leave it. That's that you've got to actually be in touch all the time. And if your GP knows you well, he'll spot those things, and he knows what other people's histories as well as your history. He's got to take all that together, and hopefully spot things. I see that Viv saying that Anita's friend said she also feels safest in the hospital. There we go. Anita's friend says she also feels safest in the hospital and very vulnerable outside. So perhaps the fear of hospital is unjustified.
No, I don't know what you think, Nicolas, but I mean, I think that we've tried to create this idea that our hospitals will be the safest place in the country, so that people can be confident to come to us, and that we'll do everything that we can to keep you safe. But how will you make your home and your transport to and from work just as safe?
Nicolas, you're in your practice, have you had a big uptick in the amount of COVID cases and lots of any asymptomatic stuff, what are the kind of numbers like,
Yeah, we definitely seen a trend upwards, just following the stats. The second wave we've definitely felt it, but my practice is not. I wouldn't say we're sitting in any of the hot spots. So that's fortunate in that sense. I think up until, to give you an idea, there's myself and two other doctors working part-time, and I think up until November, sort of mid-November, around there, we had only diagnosed about 30 patients, and that was before the second wave. And then so it's not high numbers where I'm at, but we definitely noticed the second wave in terms of our busyness. And interestingly, other viral illnesses also increased at that time. So it seems as if there's almost a you could say a atmosphere or a tendency to the spread of viral illnesses, and COVID jumps on the bandwagon. So you'll get a spike of RSV, a spike of rhinovirus, and a spike of COVID. It all kind of rides together, and that's something I've noticed.
I see somebody's asking here. Viv's asking, how different are the flu symptoms to the COVID symptoms? It's like, is it possible that you've got flu? I think for me, an experience that I've had with my friends and people that I know that have got it, it's the loss of taste and smell. That's immediate. That you know that it's COVID. But I mean, how are flu symptoms different from the COVID symptoms? Are there difference?
Well, yeah, that's a very good question, and the answer is there is a difference, but not necessarily. So COVID does have a unique sort of cluster of symptoms, but it can look exactly like flu, and it can look exactly like a cold. You know, it can be a headache. It can be, there's 10% of patients who have diarrhea alone. So no respiratory symptoms, no cough, nothing, just diarrhea, and they've got COVID. So unfortunately, and that's the precise reason why there's a pandemic, is that people are spreading the virus and they don't know that they're spreading it. And added to that, you have a certain proportion of patients. It's quite few, but they have no symptoms, but they are contagious, and they may develop a bit of body aches, bit of fever, but it's really. I mean, I sat in a webinar with a professor early on, and I mean, he said something which really stuck with me. He said, if you were going to design a virus to spread, then COVID would be that virus that you designed. So it's a real.
Get the conspiracy guys going, yeah. Yeah, you're right. You're absolutely right. I mean, it's just the worst kind of thing. You know, it's just designed almost like evolution of you know, the same in the same way that a bird can fly so easily and so beautifully in the air, that despite all the wind. Changes in wind and whatever, this virus has learnt how to spread itself in the most insane way. I see Pat Wood is saying here, if one is in contact with the virus and you tested within a day, will the test be accurate, or is it better to have a test some 5 days later? Until then, until the test is done, it's better to isolate just in case you tested positive. What is the procedure? What would you say, Nicolas?
Well, I think before I answer that question, I think it's the first thing to say is, if you develop any flu-like symptoms, so and this is just a public health announcement, is if you develop, even if it's a runny nose, a bit of body aches, a headache, sore throat, tickle in the throat, a little bit of a cough, then you isolate. Doesn't matter, you know, where you are, who you are, how important your job is. You just need to isolate, and that's the first step. So that's number one. Number two, if you're in contact with someone who's tested positive, and then you isolate, and then you contact your doctor to get tested. But if you are in contact with someone, then you may contract the virus, but you may only develop the COVID later on. So we talk about an incubation period. So you've got an infection, you get infected, and then there's an incubation period where the infection it takes time for the infection to develop into the disease, and then you get coronavirus disease, and so that period is usually under 14 days. So the first thing is, if you get in contact with someone, you call a isolation period from a contact, you actually call that a quarantine. So the quarantine is 14 days, and that's standard. And so you start there. That's your stock standard response to a contact. If you then are under pressure to return to work, or there's some reason that you need to de-isolate, So, for example, a healthcare worker or the sole breadwinner of a family who needs to work to earn money. You know, there's pressure to get back to work. There's pressure to get back into the hospital. Then there is a sort of there's another route that you can go, and that's to test on day 8 of following the contact.
Okay.
Day 5 is the minimum that you can test. Before day 5, the test is useless. You could pick it up on day 5, but better to test on day 8.
Okay. So that's
even better than that is to just quarantine for the full 14 days. If you don't get any symptoms, then you can come out. If you feel fine, then you can come out. That's how we would approach it.
Yeah. Okay. I was just having a look at EMS, like basically when because I wanted to give the guys that are watching an idea as to a sort of a system or the steps to go through if you think you may have it. You know, how do you go first? Do you when do you consider going to hospital? When do you consider taking medication? Where you know, say, do you just treat the symptoms? Contact your doctor immediately. Obviously, I would think. Don't rely too much on Dr. Google. So what would you say? A couple of symptoms. So I've got a bit of a sore throat. You know, what do I do?
Well, I think the first thing to say is that sometimes I don't know what to do. So it's sometimes, you know, and that gives you an idea of how complicated it can be, just in terms of, do you go to hospital? Do you stay at home? You know, do you bring the patient in for examination? And linked to that is a whole lot of fear factors. So it's best not to treat yourself. That's number one. Don't treat yourself. Get a doctor to oversee your condition or oversee that whole process. Don't worry and stress and get anxious about it. Rather, just have a healthcare professional that's looking after you, and then communicate with them very well about how you're feeling. There's a whole lot of ways you can do that. One of the ways is to get a pulse oximeter, which can track your oxygen reading.
Oxygen levels.
And that's quite important. If you don't have that, that's okay. But then you would probably need to get a checkup with a doctor that is seeing COVID patients. So if you're feeling very unwell, you're sick, then you need to be seen by a doctor. You need potentially have some blood tests. You need a chest X-ray. But for very mild COVID, you can be managed at home. But there's a gray area in between those two. So there's very severe COVID, and then there's mild COVID, and then there's a gray area. And that gray area is even for doctors, it's hard because it's a new illness, and plus there's you can't just throw the book at them, and you can't bring them in, and just it's difficult. So consult your doctor is the bottom line.
No, thank you, Nick. I just from Rob, I don't know at what stage would you say that you got to start looking at hospital? I mean, the EMS. When do you call EMS? Is it your oxygen levels? Is it your the fact that you can't breathe? Is it when do you make that call? To go into hospital.
So Nicolas is probably better placed to answer that.
Yeah, better placed.
Because he's there. He's just doing the screening.
I think that if in doubt, call EMS. That's the first thing.
Okay.
If you're wondering, should I phone the ambulance, then you probably should phone the ambulance.
Okay.
So that's
Okay.
that's the first thing I think, and then
Okay.
yeah, just it is a killer, it's a killer virus, and so rather go in unnecessarily than go in too late. And so I would say the main dangers are pneumonia, shortness of breath. So if you're feeling well, if you're feeling, you're feeling you're not short of breath, your oxygen levels have been tested recently and they are, above 95%, and you can walk around. So there's a few criteria for managing mild COVID at home. One of them is your oxygen levels need to be above 95%. You need to be able to care for yourself at home. You need to be able to wash yourself and make your own food, and do your activities of daily living. Your breathing rate needs to be below 25. Your temperature needs to be below 38.5. Your pulse rate needs to be below 100. And so if someone's got to care for you, then that's a danger sign. That you need to get checked out. At least go get checked out. If they say, okay, you're all right, no need to go into hospital, you can go home, then don't then just say, I don't need to go to hospital. You may get worse, and so you may need to go back to the emergency room. So rather go, rather just be safe than sorry is what I would advise people out there.
A last question before we get Konrad on as well. Nicolas she says here, how long have you been in contact? How long after you've been in contact with someone who has COVID-19 do you start to show or feel any symptoms in general?
In general, it's a range. So I would say probably about, from if day one was the contact, the latest that you would show symptoms is close to day 14, and then the earliest would probably be 3 or 4 days. So, and it depends. It depends on how much virus you were exposed to, how big the contact was. So there's a whole lot of factors, but it's a range, and that's the reason for the 14-day quarantine. That's how long it can.
That's how long it is. Okay.
That's how long it can take to show up. So it can show up early or it can show up late, and so that's how they got to 14 days.
Oh, fantastic. Okay, well, thank you, Dr. Thackwray. Thank you so much for coming on board. We're going to be hearing from a couple of doctors here tonight, and thank you for your time. Thank you for letting us let us steal some of your knowledge for tonight.
Pleasure.
Are you in Cape Town at the moment? Are you down in Durban or Cape Town?
I was in Cape Town yesterday, and today I'm in Durban. We're doing a bit of a family tour of the in-laws.
Oh, excellent.
So, yeah.
Well, I hope your in-laws appreciate your hard work, young man.
Thanks, Gino. All the best. Nice to meet you, Rob. Cheers.
Nice to meet you, Nicholas.
Ciao, Nicholas. All right, Rob.
Just a very quick thing. The thing that Nicholas said is that if you have symptoms, you need to quarantine. We've just had in one of our hospitals a person go in and visit one of our patients, knowing that the visitor had symptoms and not declaring those to our staff. And when we think that child has passed, an adult child has passed COVID on to an elderly relative who is at risk of developing. So it's a hard one. It's disruptive.
Yeah.
But we really have to understand that we need a lot of awareness, discipline, and the willingness to just take that period to step aside and either stay at home for the 14 days or go and get medical advice, get tested, see what's going on if things are pressing, because sometimes circumstances are pressing. So people just overlook that and they think, no, this is just a sniffle or this is just a little this, it'll go away. And that's probably one of the reasons why we've seen this explosion in Nelson Mandela Bay and the Eastern Cape, is that people have just been a little bit about it, and the explosion has happened. There are other factors as well.
I mean, and the hospitals in general. I mean, I think Gary had a question here. The hospital space. I mean, there was a whole lot of talk about the hospitals full and no beds and no oxygen available at one stage. I mean, is it looking okay? Is it looking better at the moment? I mean, in your,
Gino,
you guys are kind of in the private side. You know,
we understand that there've been days and periods of days over the last month when many of our hospitals have been on a divert status, where they've been too full to take in more COVID patients. Fortunately, there have often been other hospitals that have had space, and we've seen patients sometimes passed from one hospital to another in order to make sure that people can get treatment. It's possible that there have been days on which there haven't been ventilators available, but generally we've had the capacity. The appeal at the moment is that if we as a population in the Eastern Cape continue to behave as we've behaved over the last months, we may get to a point where we do exceed our ability to care for critically ill people, and not just people with COVID. If you were to have a heart attack now, or a stroke, or a major motor vehicle accident, your chances of getting the right treatment are lower than they would have been in another year. Our guys, our ladies, our doctors, our nurses, our administrators in all of our hospitals, public and private, have done an incredible job. But we're now seeing nurses being recalled from leave because other nurses are sick. The number of qualified doctors to do the work that normally needs to be done is lower sometimes than it has been. So we're certainly not falling over. And there was a statement put out by MediClinic today to say, guys, we're not falling over. It's hard. It's difficult. We can't provide everything that we could at sometimes. Please look after us. And Gino, I'm sorry, I will shut up now, but people talk about
that's fine.
the front line being in the ICUs of our hospitals. And my appeal is that, guys, the front line is not the hospitals. That's the citadel. It's the keep of the castle. If we wait until COVID gets into the ICU, we've lost the war. The front line is in the supermarkets, it's in the restaurants, it's in the schools, it's on the golf course. And if we don't behave ourselves and wear our masks, distance, wash our hands, control population density, in those places, we will lose the battle in the ICUs. And it's critical that people understand that. And the reason we've gone down into lockdown is that people have not wanted to or been able to understand that. And we're now paying the price for it. Yeah, sorry. Preek is over.
No,
move on.
That's good. We need to hear this information from the horse's mouth, as they say. You know. Now, I mean, a question here is when people get coronavirus, when are they most contagious, and how long do people stay contagious? I don't know if you're in that. I see there's Mary White asking when you're not contagious anymore once you've had COVID, especially if you've had it badly and recovered really slowly. When are you not contagious anymore? So is that 14-day period?
Do you know, there are lots of different questions there, but in essence, we think that you're probably most contagious while you're still asymptomatic. You know, in the days before you actually get ill. So probably if you were exposed on day 1, probably around day 3 to day 6, you're probably at your most contagious. But you continue, if you've got mild COVID, you're probably contagious for at least 10 days after you develop the illness. So we talk about after symptom onset or getting your test done, you must isolate for 10 days. If you have severe COVID, we talk about at least 3 to 5 days after your symptoms have resolved completely and you've been declared free of COVID. But that's a difficult decision, because when are you free of the symptoms from COVID, or when are you recovering from other problems that COVID has caused? So that's something that we deal with on a case-by-case basis in severe COVID. But in the mild cases, it's 10 days after onset at least, and wait until your symptoms have settled completely. But always do that in conjunction with your family doctor, your GP, or the healthcare professional who's helping you to make those decisions.
Yeah. Okay. Well, Rob, we've got Konrad, Dr. Konrad Von Hagen. Von Hagen, Dr. Konrad, how are you doing?
Good, and you, man? Sorry, I'm trying to get a good connection. I'm fortunate enough to be in Bushmans. So
Bushmans.
my house is not
Yes,
working
you
that
lucky
well.
bum.
So you're going to get a
You
nice,
are
view
lucky.
of,
Lovely,
the
look
green
at that.
pastures of Bushmans. Hi, Rob, how are you?
I'm good, Conrad. I'm pleased to see that someone's having a good holiday there, man. Sure. I'm jealous.
I had to. It was time. It was time.
Oh, my word. And it looks like he's walked himself out. Oh, there we go. You're back. You're back. You've got a good signal
Can you
there,
hear me?
Konrad. Stay in that spot.
Cool. Let's try and find- Let's get this looks better. Can you hear me now?
Yes, I can. Yeah, we can. Okay, that's good. No, Konrad, thank you for coming on your holiday. I mean, it shouldn't be holiday time. We're talking about COVID again.
Yes, we have to. It's important.
We do. Konrad, just a little bit of a background on your, you're a sports. You were the sports doctor as well. I believe you were the rugby team and with the Warriors and Chipper.
Yeah. So I've been in sport for the last, I think, 15 years or more. Been a sports physician since early 2000s. Was fortunate enough to be part of the Bok team that won the World Cup last year. What a different year we had this year.
Yeah, indeed.
And for my sins, I'm now a consultant to the Players Union, which is my players on COVID. So what we tried to do is, rugby and all the sports going during this pandemic by keeping the players safe, but also, not taking chances with the disease spreading.
Yes. Yeah, with the spreading. I presume that you obviously. Just thinking about the exercise and the stuff is once these guys. I presume the sportsmen are the guys that are kind of least at risk. Does it matter if you're fit or if you're not fit? Does COVID does COVID care about the fact whether you're fit or not fit?
Well, supposedly, and as we know, with your comorbidities and age, you are supposed to be at a higher risk. But this disease doesn't take prisoners. So if you're young, old, some young people will still get it. We've got quite strict testing regimes in sport to get them to play, and they stay away from other people. And we do regular testing. In the rugby, we test weekly. In cricket, we test. In soccer, we test according to what our symptoms are. And but they still do. Remember, we're a town with Ironman, so all the people are trying to be fit and trying to get back. So even your asymptomatic guy that we're tested can still develop symptoms later. And when the moment they start training, that sure, something has happened to me, and then so I see quite a few people at my practice who suddenly they just not themselves anymore. And luckily there's been a lot of research and a lot done to say how you can get back into sports safely. Because if you don't, remember, this is not, we all worry about the lungs and the breathing, but also any viral disease attacks your heart. And if it attacks your heart, you need to go back slowly. If you don't go back slowly, you will have problems.
Yeah, that's a problem. And I know with I've had stories of people when they've had flu at attacking basically their heart. If they exercise, they just drop dead with a heart attack. Is it like I presume it's like that with COVID. But if you don't know you've got it, you could be in trouble.
No, exactly. This is like any other viral disease from that sense is that you have to be careful, because if you don't and you end up with a myocarditis or endocarditis, you won't do sport again and you might even die. So
Gee whiz. Yeah, that's a scary thought. It's a scary thought. And
that's where it's important.
Yeah, we yeah.
It's my. So that,
Okay,
so what we do with the sport, we do ECGs and all the tests before. So once they're in trouble, that we can see that they go back to their baseline, and a lot of people won't have that. So that's important to talk to your doctor, see that they feel you're fine, and then get a gradual return to training approach. If you're just going to go back to where you were normal, you're really in trouble.
Okay. I we constantly hear about the dangers of these of comorbidities, and you know, when they talk about comorbidities, we're talking about diabetes. Are we talking about any other illness that you've got as well as COVID?
Yeah, the big ones that we know about is the diabetes, definitely. Okay. Then your hypertensives, and anything, you know, if your immune system is down because of cancer, or because you're underweight or overweight, that's the kind of things that are comorbidities that are trouble. But this one, honestly, I've had healthy people get very sick, and I've had unhealthy people not get sick with it. So I don't want to blanket it as just one thing. Yeah,
no, for sure. And is it? We've also heard that it could be blood type. The blood type story. O positive. The O blood type is less risk, or is there any truth to that?
I wouldn't go according to what your blood type is. I would go and be safe, do the right things, and stay away. As we heard earlier from Dr. Thackwray, do the right things. If you do the right things, no matter what your blood type is, you can't now because I'm an O group. I'm at less at risk, so I'm going to take more risks. I wouldn't do that.
Yeah. What does COVID actually do to your body? Like, what is it? How does it attack it? How does it?
It attacks. It can attack every part of your body, from your brain.
Really?
Main things we're seeing is the lungs, but it can attack your brain, your heart, your liver. I've seen patients who had infarctions in the omentum, which is the little sort of a layer around your gut, and then they get little clots into that. It's severe pain. Yeah, one. And so no, it is so, and I think we're going to learn a lot more as we go along. There's not a single thing that it cannot attack.
I see Viv has asked a question. Do you think when you've if you're in contact with somebody who's had COVID, is there there's no chance of transmission?
No, definitely they are.
Oh, there we go. It's Wendy. Sorry, I see you.
Yeah. So there's definite guidelines. So if you're a contact, so the definition of a contact is if you were within 1.5 meters of someone for 15 minutes, then you're a contact, like driving the car. But if you have physical contact, like giving them a hug, then they're contact. So once you're definitely a contact, you have to isolate. And as we said, then you stick to your 10 days isolation per government rules currently. And if you do get symptoms, then you get tested.
Yeah. Okay. So yeah, and obviously, but obviously, if somebody's recovered after that 14 days, they're pretty much clear if they've recovered after that.
They are, but they are also. If you go back to your workplace, the Department of Health will tell you that if you go back to your workplace, you will still need to wear a surgical mask and not a normal mask for at least 21 days. To make sure, because they still, if you go and do your testing and you retest after 10 days, you can still test positive. There's people that still test positive for up to 12 weeks, but it doesn't mean you're still infective.
Okay.
So that's just the test,
Yes, yes. Okay. So they insist on it. I didn't know that about the surgical mask at the workplace as well. So 21 days. That's and then let's see that. And I mean, obviously the general symptom timeline for COVID infection. So we kind of worked through that with Dr. Thackwray, but does that change? The picture change as they become more severe. So when you're really sick with it, does that timeline then move on?
Yeah. So we say your timeline is from when your symptoms for the severe patients, then it's still from when you're better, we still give another 10 to 14 days.
Wow. Okay. So yeah, geez, I mean,
So that's
when
that's
your
your
fever breaks, or
hospitalization. Now, the thing is, your symptom line is, so if your normal person is still when your symptoms start, then it's 10 days. But if it's
Yeah.
somebody that's severe, we wait longer.
Okay.
We take a longer, and so then it's not when the fever breaks. It's sort of when they off the ventilators, etc., and get out of
Okay.
hospital. We still want them to
Hospital.
be away from people for another 10 days.
Sure. Okay. Okay. So depending on severity, you just extend it as well. That's
Yeah.
very interesting information. Good information, that
and
Dr. Konrad.
those guidelines are available because that's the government guidelines. So it's not it's available for everyone to see where they fit in there.
Okay. Okay. And I mean, you said coronavirus actually attacks. I mean, if it attacks your brain, what you're talking about, headaches and stuff like that as well.
The thing is, headaches is the normal one that we get, but like any other virus, it can give you encephalitis. So that is a more severe headache. Luckily,
Okay, yeah.
it's still treatable and manageable.
I see. Annie's asking you how long the antibodies last after one's had COVID. So your immunity. So that's another whole topic, isn't it?
So that is
immunity
that
afterwards.
is currently we say 12 weeks, and I have seen patients tested positive after 12 weeks for the second time. Funny enough, I would have thought that the second infection would have been less severe, but in my patients that I had, it was more severe. So there's a lot of questions about this virus. So at this moment, we say 12 weeks. There's French studies that say 6 months, but 12 weeks, yeah.
Yeah. Okay. And I don't know if Rob's heard as well, but I've heard stories about a French a French vaccine that's available in the black market. I don't know if I try that myself. I don't know what you guys think about vaccines on the black, little French vaccines on the black market.
I wouldn't buy any vaccine on the black market, to be honest.
I was thinking the gin and tonic.
The gin and tonic. Better, I've got some of that. Maybe inject some bleach. Is that the better route than doing?
Let's not go there.
Oh, my. Okay, we won't go there. We're too hectically. What about children and COVID? What's the story there?
I'm just going to walk back home because now my charger is also, my phone is nearly not charged, so I'm very well prepared for this.
Okay, that's fine, Konrad.
Children are super spreaders, so the problem with them is they're asymptomatic. They have a little cough and a little sniff, and the next day they're fine. But they're the ones that spread it, and the risk is there for the parents and all the people surrounding them and the people that are at real risk. My kids are at Woodridge, and so the school stopped a week and a half early because of the outbreak there. And it's just because we don't listen. Rob said it earlier. Is that we just don't listen. We still allow all these parties. We still allow people to socialize and actually think nothing's wrong. And for the kids, they're fine. But it's for their parents. It's for their grandparents. It's for the people that are at high risk. Yeah.
It's those guys. I mean, this and I see. I mean, obviously the kids, and the kids are like fly paper to the grandparents. You know what I mean? Those young
Yeah.
kids.
Absolutely.
So the grandparents, they can't help but go and hug their grandchildren. That's all they want to do this season. And oh man, what a terrible thing. I see Gabby Hughes saying some people are using veterinary meds to prevent COVID. What's your opinion on the veterinary meds? Is that this ivermectin?
Sorry, I
Do you
just
know
was
about
plugging
that drug, Rob?
Gino, we honestly have to say that we are still learning about this virus on a day-to-day basis. There may well be other treatments available, but nothing is proven. And anything that's not proven and scientifically established must be regarded as witchcraft. And I would avoid it like a plague. Sorry.
Yeah.
But, you know, we saw at the very beginning that we thought that hydroxychloroquine was going to be helpful. You know, all the established trials that have come out subsequently have shown that it's not effective. So by getting involved in unproven, unscientific treatment, you expose yourself to a higher risk of complications and problems. And you're really just muddying the water. So stick to the good stuff. In most people, your immune system is going to beat this thing. In people who do get really ill, we know that there's good treatment that is available that will save most people. And sadly, there are a couple of people who we're not going to be able to save. We may learn what to do in future, but at the moment, there's no science. And I think it would be wise for people to steer clear of speculative, unproven treatments. We've vaccinated in a way that are going to be really effective and really safe. And I think the thing to do is to stick to the conservative, non-pharmaceutical measures. Stay away from each other, don't wear the masks, do the boring stuff, and you'll be there to survive into next year. Sorry.
Yeah.
The break is over.
No, absolutely. There's one thing that I know both of you are interested in, and is that's the kind of the anxiety and the mental health effect that this whole pandemic has had. I see some people online asking about, you know, because you get COVID and then you all of a sudden think, oh my, you know, you've got so many questions coming into your head immediately, and you just think the worst, of course, and then Dr. Google doesn't help much when you're thinking about the worst either. Konrad, do you want to have a go at that first?
I absolutely agree, and I'm seeing it daily in the practice, and it's twofold. It's number one, you're sick, you're worried about making other people sick, but also, you know, the effect of COVID on the economy. So people are losing jobs left, right, and center. They are worried about where the next day. So the mental health side is massive, and you know, your patients are normally more scared about things and have got a different personality, and you know how to manage them and help them through it. But the bigger picture is, you know, being in Bushmans today, you know, it's great, but now the rivers, everything is closed. Yes. So I went to the spa, and nobody made eye contact. People are punch drunk. It's like, just when we think it's getting better, it goes back again. And for all of us, it's from the medical professionals to everyone that plays. I mean, the doctors are tired, but so is the average person on the street is also tired. They just want to have a little bit of normality, and we don't have that. And my big concern there is that what are we going to do, you know, 6 months from now? You know, winter's coming. If we don't have an answer for this, is there next strain coming? We don't have answers. We don't know.
Rob, on your side for the mental hospitals, have you had an uptick in that sort of thing?
No, we're certainly seeing more severe mental illness. We're seeing neglected mental illness. People are also frightened to come and look for help early. People who have existing mental illness are often not getting their treatment and their counseling the way they should, and presenting a lot later than they would have in the past. And so it's really we've seen more severely mentally ill people. We've seen an uptick in substance abuse through this whole thing, there's been a documented increase in suicide rates around the world through COVID. And it's difficult to know, is that because of the increased strain, or is it because of lower levels of available care for various reasons? But certainly we under strain. I agree with Konrad. I mean, everyone, it's universal. The strain of being isolated at home, the strain of being in lockdown, the strain of not being able to earn a living or go to school or go to varsity, not having the contact we have with each other is telling, and it's going to carry on probably through most of 2021. We're going to have to knuckle down and really find ways of supporting. And Konrad, I mean, sport, exercise, disciplined routines are probably the ways that we can find our way through this. Walking, running, cycling, getting engaged in sport, and taking us out of the misery that a lot of us find ourselves in.
Konrad, have you found that is the exercising the thing, at least for the mental as well? I find I run. My jogging is my thing. It's meditation.
I think for so many people that's just an escape, and it's a great escape because it keeps you healthy, and you also get your vitamin D that you need by getting out in the sun, and it just keeps you keeps you sane. So exercise.
Yes, I see somebody talking about vitamin D. It's a Hawks, Stuart Watkins, saying vitamin D, bud, helps with the cytokines. What is that?
That's a very technical term. But it just helps with the sort of inflammatory response that you get from it. And a lot of us think we've got vitamin D because we live in a country with sun, but what we forget is we all put sunscreen on. Not that I'm saying we shouldn't use sunscreen, that's the right thing to do, but we try and prevent it, and by doing that, we don't actually take up as much vitamin D as we should. And because of our population as well, our colored people and black people, who's got more melatonin, actually absorbs less vitamin D. So a lot of our rugby players that's got a darker skin, we need to replace their vitamin D. So it's a standard blood test that we do on them.
So you got to get it in.
Is a very, very important part of our normal everyday that we should know, and it's a simple blood test that you can do to see if you are deficient or not.
Okay, and obviously I think outdoors, fresh air. That's always good. I see there. My wife's on me already. She's saying they're getting outdoors to the sunshine and fresh air.
I agree with your wife.
That's what everybody does.
I think Rob will agree with you 100%. Is that the big thing we need to do in this strange time is we need to sleep well, and we need to eat well, and we need to look after ourselves. That's the number one.
Sleep well, eat well, look after yourself.
Our bodies are better equipped to tackle these viruses that come fast.
Yeah, for sure. You were talking about anti-inflammatories, and I know that there's been a couple of people talking about the good and the bad of this prednisone thing. You come in with COVID and you go straight for the prednisone, hit it big, and I think there's possibly a time that you go and do these medications. I don't know what you kind of prescribe for the COVID stuff. But
if you're asymptomatic and mild to moderate, I wouldn't go for prednisone straight away. It's still a virus. Viruses get activated or get super strong when you give them cortisone. So you're only going to use the cortisone when it's really needed. So if you end up in the casualty, they will use it. But every single one that's got mild symptoms shouldn't be having cortisone, not at all.
Okay. So it's only in the hectic cases. I think, because I know Andre, who works in the COVID ward at Livingston, was saying that they would only do it when there's really they're really bad. I don't know if that's the case with you, Rob.
Gino, they really
One of my ways to keep up to date is by speaking to the casualty doctors.
Yeah.
And they find that the mild patients that's been treated with or minimal symptoms that's been treated with cortisone, they actually progress quicker to the next phases. So I wouldn't use it in a so by the time you're there, then you deserve your prednisones and your cortisones. But it's not something that you should say, I've got prednisone for my dog and I'm not feeling great now, so I'm going to use it anyway. I wouldn't do that.
Rob, in agreement there?
Absolutely. I mean, Gino, I think the important thing for people to understand is that there are two phases to COVID. There's a virus infection phase, which most people get and lose, but in a small proportion that moves on to an immune overreaction. So the severe COVID is not often the virus itself. It's your body's overreaction to a strange virus that we've never encountered before. We saw the same thing happen in the 1918 Spanish flu epidemic. There's this uncontrolled, severe over response from our own immune system, and our own immune systems are killing people and landing them in ICUs rather than the virus. The virus sparks off the initial overreaction, but then the overreaction kicks in like an out of control fire, and it's only when you get that out of control overreaction that the prednisone is beneficial to you, or the corticosteroid is beneficial to you. I agree with Konrad. If you simply have a mild illness with a mild viral illness, your body will probably clear it up. If you get to that overreaction phase, then we would kick in very quickly with high doses and the right doses for the right period of time, and then it's beneficial, but for a different problem.
Yes, absolutely. Okay, and just Konrad, what would you say a daily regimen? If you to keep your immune system up there. Konrad, are you there?
The river is breaking. The river is.
I see that. Yeah. Well, maybe you can answer it for now, Rob. Would you know what is your daily regimen for keeping healthy? So keep it out there.
Look, I think that there's some things that are really harmless and good for you, and relatively inexpensive. I think as Konrad said, sleeping well, eating well, keeping yourself hydrated. Making sure that your vitamin C and multivitamin intake is adequate, that your vitamin D intake is adequate. Vitamin D is not a miracle drug, but if you're short on it, you could get into trouble. So I think if one goes through those things as the basics, you're doing what you can. If you combine those, sorry to say, I'm going to be boring again, mask wearing, social distancing, hand washing, keeping your surfaces clean, you're doing the basics that will protect 99% of people from really, really unhappy outcomes. Beyond that, there's a bunch of unproven stuff. There's some stuff that's possibly helpful, but I think those are the things to focus on, and those are the things that should pull you through.
Okay, well, we've got to have a bit of controversy on the show. So we've got Ed Gucci sent in a video about his thoughts on lockdown. I mean, our lockdown, we've all been hammered with this lockdown, and so he's given a bit of an alternative thing here. We've got a little video. Gary's giving me a message here. He's saying emphasize that. So there are two sides to this story about lockdown. One is obviously that we're locking down and we're stopping the virus from spreading, and the other side is that we're locking down, we're killing businesses, and we're killing more people in that way. You know, I see Ed's got his video that he's sent us. We're going to give him a go here. Let's have a look. And just Gary says if you two can stand by, says you can react to it. Just tell me what you think. Here we go.
Hi, good afternoon, listeners. And Gary, thank you very much for asking my opinion on this rather serious and almost tedious discussion topic. Firstly, I do acknowledge the severity of COVID. I also certainly acknowledge the great work and sacrifice that all the frontline workers have made. The doctors and nurses on the front line, people in the testing, in the laboratories, have made a huge amount of sacrifice, and at all times they deserve to be recognized and for our appreciation. I also feel for those that have lost loved ones or have had families that have been affected by COVID. It has come along, and I don't think there's a single person whose life has not been affected. However, I do also feel for them just as much as I would feel for the far more numerous people whose lives are lost to TB. 135,000 lives a year are lost to TB versus 27,000 this year to COVID. The other people that are lost to HIV, cancer, and all of the people that have lost their businesses. Now, I often get a lot of criticism for people going, oh, it's a business, you can just get it back. No, it's not. A business, when you start your business as a business owner, it's your child. When you build it, you employ people, you take your staff on. And through the course of this year, I've put so much time and effort into looking after my staff, but what's been tragic is seeing how many of our clients have had businesses for 15, 20, 30 years, and overnight they have lost their entire livelihoods, all of their staff gone. And everybody goes, oh, well, they're still alive. Well, no, not really, because their families have been ripped apart. Depression linked to COVID has caused a huge amount of suicide. In Australia alone, over 1,200 suicide cases linked to COVID depression this year versus 120 COVID deaths. 1,200 suicides because of COVID lockdowns compared to 120 deaths. Doesn't add up. Bottom line, I'm a simple numbers person, and since the early stages, the numbers and fear narrative told by the media and government has not added up. From the early days, the numbers were unreliable. The numbers are still unreliable because the reporting changes continuously. At one stage, we were being told how many people were recovering, and for most of the time, the number of recoveries was almost as much, about 99% as many recoveries as people were falling ill. Why all of a sudden are we only being told about the deaths and the people that are being affected daily, and no more about recoveries? But the recovery rate is still at over 95%. That hasn't changed. However, the narrative has, because all of a sudden nobody is getting to hear about the positive news, and there is positive news. But to me, the numbers just don't add up. And if you would like, I would sincerely recommend that you look at a very reliable site. It's a bunch of mathematicians and scientists, and they've got a page called Pandata, and it's highly reputable. They are globally acknowledged. And look at Pandata, and you can see the numbers for yourself. My third point is COVID is not just a virus. It isn't. COVID is a lifestyle illness. Well, I think that the deaths related to COVID are very much a lifestyle illness. And this is where I think a lot of people make the mistake. They think, oh, it's an elderly illness where people who are older are going to die. That's absolutely incorrect. Look at the facts, look at the numbers. There are 3 basic comorbidities linked to COVID. And funny enough, all of those comorbidities, all 3 of them, are primarily linked to one thing: obesity, which is also a lifestyle disease. And you can't dispute this fact. The 3 top comorbidities related to COVID are the same as found with obesity and lifestyle illnesses. Those are high blood pressure, diabetes, and cardiovascular failure. Those are not flu-like illness symptoms. No, you will get COVID. You will get almost any illness. You will not necessarily get you won't get a heart attack. You will not pick up diabetes. However, people with diabetes, with a history of cardiovascular illness and high blood pressure, doesn't matter their age, whether they're old or they're young, have a far higher mortality rate. So age is not necessarily a factor. So in short, my personal feeling is COVID is very much, or COVID mortality is very much lifestyle, obesity linked, and in short, if you tackle these issues rather, get people to get active and not locking them down, you will not just solve the COVID problem and have fewer COVID deaths, but you will also effectively solve much greater issues, because far more people, about 14 million a year, die from obesity versus just over 1.2 million from COVID. So if you can solve the lifestyle issues around this and reduce obesity, you will effectively ensure that cardiovascular, blood pressure, diabetes issues also reduce. Fourth point, an immune system. I just can't remember the last time that Zweli Mkhize and Nkosazana Dlamini-Zuma or the World Health Organization, anybody, actually highlighted the fact that we as humans, since caveman days, have this fantastic thing called an immune system. Now, since we were kids, doctors told us to expose ourselves so that our bodies could build up resistance and antibodies to various illnesses. They also highlighted the fact that good lifestyle and exercise and diet and being exposed to various germs would lead to a better immune system and more antibodies. Even in October, Minister Mkhize acknowledged then, and this was October, that over 20% of South Africa, or of South Africans, had already been exposed and built immunity and therefore antibodies to COVID. At that stage, there was around 10,000 deaths. Now there are 27,000 deaths. And COVID was very much more limited in October. So why is it, again, that despite the fact that we are over 3 months down the line, far more people have died, that the good news that there must be far more people that have been exposed, that have built up antibodies, and that we should be focusing on building your immune system? Why is nobody actually talking about these things? It's always a negative. It's always, you've got to lock down, you've got to stay indoors, you've got to... How does staying indoors, living a sedentary lifestyle with little exercise and exposure to the sun, getting vitamin D, how is that going to help you? Somebody tell me. My fifth point. So, who would you rather listen to? And this is just, to me, common sense. Despite Zweli Mkhize's brave work and long hours, would you rather listen to Zweli Mkhize, a man who has allegedly received dodgy payments, together with Nkosazana Dlamini-Zuma, she of Sarafina fame, and up until 2 years ago, nobody wanted her to be our president? But would you rather believe them versus the 10,000 plus doctors, scientists, epidemiologists who recently signed, since end of October, November, recently started signing what is called the Great Barrington Declaration? And effectively, you have got the head of science, medicine, epidemiology from institutions such as Harvard, Oxford, Cambridge, Yale, London Medical School. You go to Germany, you go throughout the EU to Israel, the Middle East, Australia, New Zealand, America, South America. You go to all of these countries, all of the top doctors, epidemiologists and scientists have signed this.
Yeah, there we go. No, no holds barred with Ed. Yeah, all right. So Rob, I don't know. It's just, it's obviously anti the lockdown and going for I think where it's a lifestyle disease. I don't know. Have you found it? I mean, in your experience, have you found that it's most definitely lifestyle related as well?
So I'll try and keep it short and sweet. With respect to Ed,
yes.
First of all, anyone who wants to go and fact check the Barrington Declaration can do so.
Yeah. Okay.
There are a bunch of kooks who signed up to it. There's a lot of good commentary from good scientists on the lack of validity of the Barrington Declaration.
Okay.
Yesterday or the day before, I forget which, there was an article in the Journal of the American Medical Association documenting that this virus is indeed more risky in people who are older. Age is the most important determinant in a large, well-constructed scientific study. Secondly, people with diabetes with complications, not diabetes, diabetes with complications, hypertension with complications, and then a host of other lesser factors contribute to severe COVID illness. There's good science about this. These problems were not triggered until COVID came along in the same way. So they predispose you to severe COVID illness, but the virus is the trigger that creates the catastrophe. Listening to Ed talking about COVID reminds me of Thabo Mbeki and his AIDS dissidents telling us that AIDS was a lifestyle disease. Sorry, bullshit. The virus is the critical ingredient here. Our immune systems have never met this particular virus before.
Yeah,
we are ill-equipped in a way that few people can understand. What this virus has told us is how little we know about science. About the science of immunology that's beyond our reach. With respect, I mean, I think you can get involved in the politics, and I'm going to stay clear of the politics and stay with the science here. There's no doubt that our government has made mistakes. There's no doubt that there has been corruption. There's no doubt some wrong calls have been made. But we have seen the effect of social isolation on cutting down the virus. There's a very real risk that if we allow this virus to mutate too often, it will move beyond the scope of control by vaccines, and it might mutate into a more virulent and pathogenic form. That's what we saw in 1918, 1919, when 50 million people died from the Spanish flu virus. Now, coronavirus is not the flu virus. It's less prone to mutate. We're safer in some respects from that. But there are more people on the planet. And the higher the number of passages this virus has through human beings, the higher the probability is that it will do more damage to us all. We need to, and sorry, the last thing, and let's see what Konrad has to say, is that in 1918, 1919, those communities and cities and states and countries that shut down effectively survived financially and health-wise to a much greater extent than those cities, states, and countries that did not.
It didn't.
It's a bitter pill to swallow, and I no doubt that Ed may have some good points. Some of the lockdown regulations have made absolutely no sense. Some have. I've just heard tonight that we are already seeing an uptick in the presentation of new cases following the Christmas period. More people are starting to present. More people are testing positive than were in the previous 3-week period. The more we congregate together, the more we get together and behave against the regulations, the more the risk is of more infections, more sick people, and more deaths. And I don't want to, for a moment, to be arrogant and say that all of what Ed said is wrong. But quite frankly, I think it comes through a distorted lens that does not tell the truth, and that we are going to have to be more disciplined as a nation. The more disciplined we are, the less lockdown we'll need. But we are going to need to push through this. This is a virus. It is not a lifestyle disease. That is.
And the one thing I think with the lockdown is that it stops that exponential growth. I mean, surely, which would eventually beat the economy to death. That's my view on that. But you know, I think it is still for the. Yeah, say.
Lockdown measures have been effective, and they have caused economic damage. But in general, the probability is that they cause less overall damage than doing nothing at all. Konrad, I don't know what your take on that is.
You know, Rob, I understand and I agree. Lifestyle changes are important and stuff that we have to do, but that stuff we preach every day to people in the practices that we need to live healthy. So that's nothing new. The reality is what we're seeing out there, seeing your colleagues in tears because they don't have a bed, they have people dying. We've never seen this. In my lifetime, I've never seen this. I don't know who else have seen that, but that's the reality, is that we cannot cope with this virus. So if we're not going to behave ourselves, then somebody needs to tell us how to behave, because we don't. And that's why we're sitting in the situation where we're at, because if we were listening and we were social distancing and wearing our masks, washing our hands, doing our basic everyday things, eating well, sleeping well, as we said before, exercising, we would be okay, but we're not doing that. So somebody else has to make a decision. Yes, a lot of the rules that are made doesn't make sense. Like if you want to go outside and walk and have a swim on your own, doesn't make sense. But it's here. We're seeing it, and I'm worried about the second one, because the second one was nasty. I'm worried about the third wave, but if there's more waves coming.
Third wave, yeah.
So, yes, let's start walking, let's start eating, losing weight, doing those things about the lifestyle. But we don't have the answers. I think Dr. Thackwray said it earlier. Is there's a lot of answers we don't have. We don't have them, but we can't now just say, let's go on with life, and your patient that's got a heart attack dies because there's no bed for him, which you could have saved. Your cancer patient that you could have saved is now dying. Your stroke patient is now dying because everything is full of COVID.
Now, I've got just a couple more questions before we leave it up. How do you guys keep up to date with the latest COVID stuff? I mean, I think these days we've got WhatsApps, we've got WhatsApp groups, we've got internet, we've got webinars. How do you guys keep up to date with this stuff? Konrad, maybe you take it first. Have you got a take, Konrad? Oh, he's gone. He's back.
Okay. Gino,
Rob, for you?
Gino, there's some brilliant scientific medical journals rather than witchcraft journals that provide daily updates of peer-reviewed articles of reliable research coming from all over the world. The JAMA, the Journal of the American Medical Association, the New England Journal, the Lancet, the British Medical Journal. There are a number of journals that are producing really good work on a regular basis. We are also in contact with colleagues all over the world. We have colleagues in the US, in Australia, in India, and in the East, who are swapping war stories on a regular basis, as well as good research. So the community has really risen to share the knowledge as we learn it. And it is being made available on a regular basis. So I have to get up every morning and spend an hour looking through the journals, seeing what new stuff has come through. The National Institute for Communicable Diseases, our national agency for infectious diseases, provides brilliant support, brilliant information, and good science-based guidelines. And Ed mentioned that he didn't think that we're reporting recovery rates. I track 2 websites in South Africa on a daily basis where recovery rates are being reported on a daily basis by province and by country. So we're getting good information. You just need to know where to look for it.
Yeah.
And you need to be prepared to go out and find it.
Yeah, okay. Konrad, I don't know if we still got him here. Konrad, are you still there? You might have gone. I think he's going to relink again. But I don't know. I don't know if you would know this, the answer to this, Rob. But once someone's tested positive, the equipment and medicines that they need, I suppose that would more be a doctor's, a frontline doctor's question. That. So put you.
just very simple. Gino, while you've got mild illness, it's really fluids, paracetamol, the vitamin D, the multivitamin, the vitamin C. Once you start to get into more serious infections, the main drug we're using in South Africa seems to be the corticosteroids, the prednisone and the dexamethasone. You often need antibiotics for secondary infections, and then also symptomatic relief of nausea, diarrhea, chest problems. Overseas, they've been using things like remdesivir. There's a lot of controversy about whether it actually works or not. Some trials say that it does, and sometimes some trials say that it doesn't. I think we're going to see a lot more developing. We've had the immune serum transfusions that we've heard of from the States, that ex-President Trump, soon to be, is rumored to have had. That seems to be effective, but it's not a solution for the masses.
Because it's too expensive.
And there are some other drugs in the wings, but the problem is we really need to establish, do they work for sure? You know, I mentioned earlier on the hydroxychloroquine was meant to work. We thought it worked. There were early trials. When we really did the trials properly, we found out that was actually not the case. And then you're committing a lot of energy, time, expense, resources to something that doesn't work, rather than focusing on doing the things it does. So you know, at the moment, the difference between this and flu for most people with mild illness is its infectivity and its risk of infecting other people. Otherwise, you would probably treat mild COVID very much as you would ordinary flu, but with strict isolation in place. Konrad, I don't know if you agree with that.
Absolutely. And looking at the new strain, that is the big thing. The viral load is higher, so the infective rate is higher. So it's just going to spread quicker.
All right, and Konrad, while we got you here, I know the internet in Bushmans is a bit dodgy, but it's fine. Just the monitoring of O2 levels. When do you decide? Well, is the monitoring important, and how low can it go? How high and low can it go? What's the story there?
There's 2 ways to it. So if you're an anxious person and you're going to monitor your O2 the whole time, it's not going to be great for you. So if you sit at home and you're watching your sets the whole time, you're gonna worry and it's going to not make you better. But yes, it's a good tool to have if you use it right. So a lot of people will put it on quickly and then they have a low count and then they stress about it, where you should give it on, take a few good breaths, relax, and then see what your level are. But it's a good way for you to see if you're in trouble. So if you're going low, and if you start in the 80s, then you know you need to take it serious. But there's also what we call happy hypoxics. Those are the people that can have a low oxygen level and they will still be fine. Like People that had asthma as a child, they are used to not having that much oxygen, so they will be normal functioning at a SATs of 86% and no problem, where somebody else at 86% would be highly short of breath and will need to be in a hospital environment.
Yeah. Okay. Any medication that you would recommend for somebody that's got it, that starts with the symptoms and knows they've got it, they lose their taste and their smell, they've got COVID, anything they can take or anything they can do that you would recommend?
I would stick to normal flu meds, and also, just give me a second. I've moved space now to try and find better. So the kids are in and out. Sorry.
That's all right.
That's holiday for you, man.
Yeah.
So I would stick to your normal vitamins and your normal flu. I wouldn't go and do anything else without speaking to your doctor what you need extra. So there are people that suggest antibiotics. There are people that suggest nebulizers. There are people that suggest other things. All of them need to be controlled and we need to know what we're doing and treating with the according to a medical plan and not just a general thumbs up.
Yeah. Okay, just a few more. Just while we've got you here, the long-term effects of COVID, and maybe Robert would like to chime in as well because he's in the rehabilitation section. But Konrad, long-term effects.
Yeah, we're gonna learn a lot more, and I think it's going to be an interesting academic route for us to know what the long-term effects are, and we're already seeing it in funny presentations in practice that you wouldn't really know, and if you have to track it back, you'll see it was COVID related. As I said earlier, COVID is a multi-organ disease, so we're gonna learn as we go along.
Yeah.
And the big part there is, I said earlier, is trying to prevent it from becoming a chronic problem for you.
Yeah.
So don't go and exercise if you're not 100% right. And if you're feeling uncomfortable, let your doctor clear to exercise. And if you start, then start slowly, have a definite plan how you're going to do it.
Okay.
Otherwise, you will end up with heart.
Okay, so the rehab section, yeah.
This disease also
it's disappearing. Rob, would you say that's the case in the hospitals as well?
Gino, I think that the people with mild COVID often present with lots and lots of exhaustion and poor endurance for a long time, probably 6 to 12 weeks after they've had it. Wow. They often present with a lot of anxiety and trauma. It's kind of a near-death experience. You may not have got that ill, but you were worried that you were going to. And there's that confronting my mortality. For the guys who've had more serious illness, it depends on how that immune system over-response hit you. Some people have had their lungs essentially not destroyed, but severely damaged. And some people have remained oxygen dependent and really unable to get to breathe properly. Some people have had their hearts really weakened immensely. Some people have had rhythm disturbances of their hearts. Some people have had strokes. Some people have had amputations of limbs. So it depends on how. There's some awful consequences of this illness, and it's really the result of an immune system that has gone completely out of kilter. The impact of the viral trigger on some unknown sensitivities. And as Konrad said, we'll learn more about it as we go along. We've only known about this virus for 2 days short of a year now. We're just cracking the surface. It can be incredibly damaging in some people. Fortunately, it's in the minority. Most of us get over it and get on with it. but we could get it again, perhaps. And once again, I'm going to sound like a stuck record. We need to prevent it. We need to keep it out at the real front line, in the supermarkets, on the taxis, in public places. We need to prevent ourselves from getting it, so that we don't have to learn these awful truths.
Just last one for you, Rob. I don't know if Conrad's going to make it back. His river.
Struggling.
They're not even allowed on the river anymore. It's such a nightmare for them as well. He's probably got his boat and everything down there, I think. He's got to, oh my word.
Are you allowed in a boat on the river? I mean,
no, he might be.
On a boat.
Might be. There's Conrad there now. So Conrad, a last one before you go back to your river, to the boat. Well, I don't know if you're allowed on the private bit of water that you're allowed to go onto. Oh no, he's gone. But is he, his mic is muted, I think. Okay, it's not unmuting. I think Conrad might have muted his mic. I don't know. Oh, there we go. There we go. Conrad, can you hear us? He's in and out. I think Conrad. Thank you, Conrad, for coming on. I think we'll ask Rob the last question. It's fine. I think just a new strain. Gary wanted to know about the new strain of COVID. If you know anything about it, if you can give any advice on it, or what's happened there.
So I mean, we're still learning. It was inevitable that we would see new mutations creep out of the woods, and they have. Nelson Mandela Bay has the infamous and dubious honor of being one of the starters of the world. You know, not many things.
We're so good. We're so good at COVID. We can create our own, very own freaking mutation.
We were that good at it that we created our own version, and which is now spreading all over the world, from the armpit of Africa. What can we say? Gino, seriously, it looks like this variant is more infectious. It latches onto us more easily than the old variant. So we probably need less to cause an infection than the previous one did. It spreads more quickly. It doesn't seem to be making people more sick than the first variant. And there's some feeling that it probably is not at this stage going to interfere with the efficacy of the vaccines that have been developed yet. We don't know that yet. But this is the real risk, is that mutations will emerge because we are ill-disciplined, that go beyond our ability to control them with vaccines that we've spent months developing. And we now need to roll out. I think Stuart asked early on, how are we going to get this done, vaccinate 6 billion people in a year? Look, we got people onto the moon. We've sent probes to Jupiter. If we put our minds to it and we're committed to do it, and we have decent leadership, we'll probably be able to do it. You know, we produce how many million bottles of Coke a year?
Beers. How many beers have you had, Stuart Watkins?
If we can do that, we can get the vaccine out there if we put our minds to it. But if we get the vaccine out there and we've mutated a new virus that no longer listens to the vaccine, we're in deep trouble. At the moment, our South African variant seems to be controllable. The new ones that we're seeing from other parts of the world, I think one from Nigeria, there's another one from the UK. They seem to have not altered too badly, but that may come. And the best chance, there are really 4 reasons to contain this virus. The first is to prevent myself from being sick. The second is so that I don't pass it on to my granny. The third one is to save our economy. And the fourth one is to prevent it from mutating into something awful, like the Spanish flu. And we really have that opportunity as we go into the new year. It's the challenge that I guess it faces us. And I'll shut up now.
Okay. Rob, Conrad, you're back. You're in. Oh, it disappeared. We haven't got sound. We haven't got sound for some reason. I think his sound's disappeared. No, we can't hear you, Conrad. We can't hear you. But Conrad, thank you. Just even if we can't hear you, it's fine. We just want to say thank you for coming on and sharing your knowledge and your time. I really appreciate it on your holiday. We appreciate that. 2.5 hours. This is our longest show. I think we've just done our longest show ever. Thanks, Rob and Conrad for coming on, as well as Nicolas as well. Thank you so much. Dr. Thackwray came on too. You guys have been wonderful, and I'm sure you've answered a lot of questions that we were all sort of wondering about, and made us hopefully made the guys feel a little bit safer, a little bit like they've got a bit of a plan, and there are people out there that are there to help as well. So thank you to you both.
Thanks for having us, Gino. Appreciate it.
Thank you, Conrad, and thank you so much, Rob, for co-hosting with me tonight. Pretty much, it was fantastic.
Good. Thanks, Gino.
All right. Thanks and bye bye. And we'll put you backstage as well. We've got, and thank you for joining us for Gino Spot. I've got one more thing to do, and that's competition. So everyone that's online, you can type in the name of the song and the name of the artist of this next song that I'm playing on the drums. Then you can win a case of Fitch and Leeds right now on your keyboard. So are you ready to go? It's a South African thing, and it's a clue. It's a clue as well to our next guest on Saturday. On Saturday the 2nd, we've got a guest. Thank you to our sponsors, Fitch and Leeds and Spa, and thank you to Amovia. All right, so I'm going to head over to the drum cam right now, and we're going to do the song. I want the name of the artist and the name of the song to win your Fitch and Leeds. Even if you're in England, you can also win it. We can deliver it to you there as well. Anywhere in South Africa or in England or in Ireland. I don't know where else they can deliver, but we'll try. All right, here we go. That's right. Carol and Brunette Fowler, you got it. Show's over and it's time to say goodbye. Thank you very much to all our guests, the doctors, for giving up your time. And I hope you enjoyed tonight. It was a little informative, a little bit more serious than the usual Gino spot. The home to go to. And Carol, Brunette Fowler, you have guessed our Better the Devil You Know by Stingray. And we have Dennis East on Saturday. Dennis East is our special guest from Stingray, the singer, the vocalist. And we're going to talk about his whole history. He's an amazing guy. And he's got some awesome stories. See you on Saturday. Thank you to Spa. Thank you to Fitch and Leeds. And thank you to Amobio. Thank you. Thank you. Spend the night with
down, coming out of PE town. One drink, find a shot, never mind your liver, get to Gino's spot.
Gino's spot.